This is the opensource.club, a free St. Louis-focused knowledge share podcast. Through industry experts, entrepreneurs, personal stories, and more, we provide the information you need to achieve and thrive. Always visit our website, theopensource.club, for more details. Contact us on Facebook, Twitter, or LinkedIn.
Originally designed to give access to care in areas where there is a shortage of specialty providers, telehealth technology has become the popular healthcare option. 91% of those surveyed reported that their telehealth visit was equal to or better than that of in-person visits. 95% said they were absolutely satisfied with their experience. Telehealth is creating a safe and convenient future for healthcare. I'm your host, Ruth Ezel, and this is Healthy You by the Open Source. This episode is sponsored by Planned Parenthood, a trusted healthcare provider and educator.
You're listening to Healthy You by the Open Source. Become a subscriber and hear all our shows. Go to www.theopensource.club and insert your email address in the podcast subscription window.
My guest today on Healthy You is Charity Galgani. A director of nursing, Galgani is Planned Parenthood Director of Clinical Services, which works to ensure patients receive the best possible care. Galgani is a member of the Midwest Nursing Society, National Association of Nurse Practitioners in Women's Health, and St. Louis Nurses in Advanced Practice. Welcome, Charity.
Thanks, Ruth. I appreciate you giving me that introduction. It's nice to be here.
Oh, great. I'm looking forward to talking to you. So tell me about your responsibilities as a Director of Clinical Services.
Yeah, so essentially I'm responsible for implementation of new clinical services, along with ensuring that our established services are going well and sort of getting a fresh look every now and then. I also sort of dabble in quality and some regulatory compliance. I'm a big policy writer for my department. It's sort of my nerdy vice. So I've written over 70 policies in the past year, which I'm, again, very nerdily proud of. And then I'm also a nurse practitioner by trade, so I care for patients as well.
Okay. Well, the subject today is telehealth. Now, I'd imagine that very few people know it's offered at Planned Parenthood, so explain how the system works there.
Yeah, so we went live with telehealth services in March 2020, and actually coinciding with the COVID-19 global pandemic. We knew we had to have an option to meet patients where they were, and so there was no question we had to launch telehealth or hesitation to get it up. And when I say services, I'm referring to our two main options. The first is sort of the gold standard of telehealth care, which is our direct-to-patient live audio-video platform, on which we provide a host of services. And the second is our asynchronous app. So in this, the patient can download our app called PP Direct. They answer a few questions, and then they can get UTI treatment sent to the pharmacy, or if they qualify, and also birth control prescriptions or renewals and emergency contraception, which can be sent to the pharmacy, or if they choose, it can be mailed straight to their door.
What's been the response so far from the patients?
They love it, actually. There's a lot of benefits to it. There's an ease of access. Patients don't have to find transportation or childcare. And for some folks, coming to the doctor's office can be really anxiety-provoking. So that's one less thing to worry about, right?
Right.
And patients are receiving the same high-quality health care that they've come to expect all along, but all from the safety and comfort of their own home or their couch or, wherever they are doing their nails or their hair. It's a great way for patients to feel much more comfortable.
I've read about how patients, when they're in person with their doctor, tend to not ask the right questions because they're so nervous. Because of that comfort level, do you think the communication level improves?
Yeah, I definitely think so. Sometimes I think patients are a little nervous at first, but I sense that they open up really quickly because it's just a much more intimate conversation, right? And again, being in that comfortable environment, just sitting on your couch, you're more likely to feel relaxed. There's nobody going to be poking or prodding at you, and you definitely can sort of get into a more open dialogue. So I definitely think that it definitely improves that communication stream.
So how many patients are we talking about right now that are using it?
Yeah, so we have actually, since our March launch, we've served nearly 2,000 patients in the Missouri-Illinois bi-state area. So that's about 50 Missouri counties and about 13 Illinois counties where we're seeing these patients do these services from.
So you mentioned this started because of COVID, but is this a COVID-only benefit, or is this telehealth an added benefit?
Yeah, so we launched telehealth specifically to serve patients during the global pandemic, but it is absolutely here to stay.
All right. I was surprised to learn the scope of services that patients can receive through telehealth. Now, I think one would expect any range of birth control, including emergency contraception, you could get through. But I also understand you can receive treatments for a variety of other conditions: yeast infections, urinary tract infections, bacterial vaginitis, I think is how you pronounce it. And then there's something else I wasn't familiar with: pre-exposure prophylactics, which I guess you call PrEP, which is a protocol for patients at high risk of contracting HIV. So I'm wondering, how is all this possible? How can a patient be treated via technology for issues that traditionally have required in-person and invasive attention?
Absolutely. And I would just go back to thinking about it as this one-on-one conversation with your provider. So we're able to do this and provide so many services because we do, in the end, still perform that high-quality care, right? We're doing a thorough history and review of systems pertaining to their chief complaint. And just by talking to my patient, I can usually, nearly always, get a really good sense about what it is they're needing that day, especially when it comes to things like UTI or if they're having discharge that needs to be addressed, for example. And so the same thing applies, right? We have to be a little more flexible in how we think about it. Like for pre-exposure prophylaxis, we need to have some labs done before we can write your prescription. So that does require finagling with the system and either writing a lab rec for the patient to take or having them come in so that they can get their labs done before we send that medication. But, it's definitely been an exercise in trying new things. But in the end, we do really feel like it is serving the patient better overall because, again, we're talking about this visit that's more comfortable for the patient. And then they can just, if they have to come into the health center for something, it's a very quick in and out instead of having to come in and sit, up to an hour and be in the waiting room for a long time and, all the poking and prodding like we talked about. So, we are able to do these services because we can still have that one-on-one relationship and talk about the needs of the patient that day. And be flexible about how we treat them.
So how does a patient get an appointment, and is health insurance required for this?
Folks can be seen with or without insurance. So obviously with insurance, we see you, and that goes off to your insurance company. For folks who are self-pay, we do offer flat fees based on this type of service that you're having the appointment for. And we do upfront payment at the time of check-in with your MA. And so it's credit card only for the telehealth appointments. And then we just go by flat fees. And then we also we recently launched STI mail-out testing. So a patient can get basically a collection set sent to their door. They can do their sample and send it right back to the lab. So they never have to leave their house for that. And that's a separate flat fee as well.
Okay, so there's no formal billing then, or is there?
Yep, that's correct. So if you do not have insurance, then you pay for your service up front.
Okay. Can a telehealth appointment be conducted like on a smartphone?
Yes, absolutely. So essentially what happens is that the patient is going to receive a link prior to their scheduled appointment by text message and email, so both modalities. And then all they do when it comes time leading up to their appointment time, they'll click that link, answer a couple short questions through that, and then they'll wait for the healthcare team to show up on the other side. And so, yes, absolutely a smartphone. Some folks use their laptops as well, but we do find that a lot of people do just go ahead and use their smartphone for these visits.
Yeah. Well, unfortunately, not everybody has access to a smartphone or a laptop or any device like that. And telehealth is supposed to be used in a private setting, but what if the only way a person can get on a computer is like at the public library? Could you provide service to someone like that who's logged on to a library computer?
Yeah, absolutely. We always make the recommendation that the patient do the visit in a private place because there's going to be some sensitive information, right? Whether it's talking about some demographics at check-in or, having reproductive health care discussions. We want patients to know that we prefer them to be in a secure place. But I will tell you, there are patients who have very widely varying comfort levels. Some folks are happy walking around the store or walking around at work with their headphones on and answering those questions, no problem. So, we do our part to recommend a private place, but we understand that every patient's needs are different and need to be individualized to meet their needs. And so we will do our very best to accommodate each and every patient to ensure that they're able to get the care that they need and that they deserve.
Okay. Before we go, anything else you'd like to mention about telehealth?
I'd just like to encourage folks to check it out. I mean, it's a kind of a new concept for a lot of folks, but it's really a wonderful way to continue to get the care you need during a really difficult and uncertain time. And Planned Parenthood is here, and we're still here, and now we're here on telehealth. So, please check us out, and we'd be really glad to care for you.
Charity Galgani, Director of Clinical Services for Planned Parenthood, thanks so much for your time and your assistance. Thanks for joining us today.
Thank you. I appreciate it.
No more excuses. Telehealth is safe and convenient. 95% of respondents who have used the service think it's great. See a doctor from the comfort of your home and in complete privacy. At Planned Parenthood, you can easily get the services you need to manage your health. Planned Parenthood has 8 physical locations in Missouri. For more information, go to PlannedParenthood.org. My thanks to Charity for being a guest on Healthy You by the Open Source. I'm your host, Ruthie Zell.
Thank you for listening to the OpenSource.club podcast. Become a subscriber through RSS or YouTube. There's more to come that you won't want to miss. Our name is our web address, theopensource.club.